Lumbar lordosis causes prevention and treatment. Have you ever noticed your lower back arching too much when you stand straight? Or maybe someone told you that your posture looks a bit curved. Well, that's something called lumbar lordosis. But here's the thing, a certain curve in your lower spine is normal. The problem starts when that curve becomes too deep. Hello, I am Dr. Kranthi Vardhan, India's #1 Ayurveda spine specialist. Today, we will discuss everything about lumbar lordosis. What is lumbar lordosis? Let's first understand what exactly lumbar lordosis is. Our spine naturally has three curves: cervical, thoracic, and lumbar. These curves act like shock absorbers, helping us move and balance. But when the lumbar curve, that's your lower back, bends inward excessively, it's called hyperlordosis. This condition can cause lower back pain, stiffness, muscle weakness, and even nerve compression in severe cases. According to the Cleveland Clinic, lumbar lordosis can be either postural, caused by bad habits like sitting too long, or structural due to underlying spine problems like spondylolisthesis or disc issues. Common causes. So what causes this exaggerated curve? There are a few common reasons. Poor posture. Sitting hunched or standing with your belly pushed out strains the spine. Weak core muscles. Your abdominal and lower back muscles support your spine. If they are weak, your posture suffers. Obesity. Extra abdominal weight pulls your spine forward. Sedentary lifestyle. Long hours of sitting tightens your hip flexors and weakens glutes. Medical conditions like disc problems, osteoporosis, or muscle imbalances, they all cause lumbar lordosis. Sometimes lumbar lordosis can also appear after pregnancy because of weight and posture changes during those months. Symptoms to watch out for. If you have lumbar lordosis, you might notice lower back pain after sitting or standing too long, tightness in hip flexors, difficulty bending forward, a visible inward curve in your lower spine, and in some cases, numbness or tingling in legs if nerves get compressed. Diagnosis. Diagnosis is simple but important. A spine specialist may perform a physical examination to check your posture and flexibility. They may also recommend an X-ray or MRI scan to measure the spinal curvature angle called the Cobb angle and rule out other conditions. Treatment options. Here's the good news. Most cases of lumbar lordosis are treatable without surgery, especially when detected early and through Ayurveda. The treatment depends on the underlying cause but generally includes physical therapy, that is stretching tight muscles and strengthening weak ones. Exercises like planks, bridges, and pelvic tilts help restore balance. Posture correction, using ergonomic chairs, standing straight, and keeping screens at eye level. Weight management, reducing belly fat eases pressure on the spine. Yoga and pilates, great for improving flexibility and spine alignment. Pain management, hot cold compress are prescribed pain relief under a doctor's guidance. Surgery is rarely needed, only in severe cases where the curvature causes nerve compression or affects mobility. Prevention tips. Prevention is always better than treatment, right? So to keep your spine healthy, stay active, avoid sitting too long, strengthen your core and glutes, maintain healthy body weight, sleep on a firm mattress, always be mindful of your posture even while using your phone. A few minutes of stretching every day can protect you from years of back issues. Final advice and motivation. Your spine is literally the pillar that holds you upright. If you ignore it now, it will remind you later painfully. So if you notice changes in your posture or experience chronic lower back pain, consult a spine specialist or physiotherapist early. Remember, healing your back is not about doing one big thing, it's about doing small things right consistently. I hope today's video helped you understand lumbar lordosis in a simple way. If you did, share it with someone who sits for long hours or complains of back pain. It might really help them. Take care of your spine because once it's strong, everything else follows.